I was recently asked by a patient who's been struggling for a little over a year if she could have something like mast cell activation syndrome, also known as MCAS, or POTS, P-O-T-S, which stands for postural orthostatic tachycardic syndrome. And there's others, but if you've been given a diagnosis of a syndrome and you're not quite sure what that means or what to do about it, this video is for you. I want you to beware of any diagnoses that are attached to the word syndrome, because typically what that means, a syndrome is a collection of symptoms or lab abnormalities without any information or knowledge as to what the underlying root cause is. And therefore, if we don't know what's causing it, it's really hard to do anything about it. The exception to this are the genetic abnormalities like Down syndrome, which is a collection of findings that varies from mild to severe that has to do with trisomy 21, chromosomal abnormalities. Just about any other diagnosis that ends in the word syndrome is just a collection of symptoms. Mast cell activation syndrome. People have rashes that appear out of nowhere. They get headaches. They get diarrhea in weird circumstances. One day they tolerate a food. The next day it makes them sick. The lab abnormality that goes along with mast cell activation syndrome is elevated histamine levels. So what do doctors do for that? They try to do things to block histamine in your body or prevent your immune system from releasing so much histamine. But they don't understand what the root cause is, and therefore there's nothing to do other than take your antihistamines or the medicines that block histamine release. And then POTS, because people with POTS, they get lightheaded, their blood pressure doesn't rise fast enough when they rise from sitting to standing or from laying to sitting. They get lightheaded easily. Sometimes they'll faint. They're given blood pressure medicine that raises their blood pressure in order to try to help the body make the blood flow up to the brain against gravity. In my experience, these syndromes are caused by overwhelming environmental toxic exposures, period. So what do I see? I see Lyme disease and other vector-borne illnesses, because it's not always a tick and it's not always Lyme. It could be one of the co-infections like Babesia, Bartonella, Anaplasma, Rickettsia, tick-borne relapsing fever. The list is long, but those things disrupt the immune system and they cause the immune system to dump histamine, not just drop it, to dump a bucket of histamine in the body at weird situations without much warning. And they also cause this dysautonomia, which means your autonomic nervous system, the nervous system that you don't have to think about, it messes it up. And that's what causes the postural orthostatic tachycardic syndrome. Another one is mold exposure. Mold exposure from toxic mold is a massive immune system disruptor. It damages the control center of the brain, which is the hypothalamus, which regulates your hormones and your sleep and your temperature and your pain sensitivity. So people with these massive exposures get sick and they can't think straight. And then because they can't think straight, they get kind of foggy and depressed because they don't feel good for so long. And they go see their doctor who runs a few labs and they're told everything's quote unquote normal. Maybe you're depressed. Well, if you don't have energy and you don't feel good and you're not sure if what you're going to eat is going to react with you and you can't figure that out, that's a pretty darn good reason to feel depressed. It's not a depression of just abnormal neurotransmitters. It's a depression of hopelessness because you don't feel good. And when you put these things together, if someone has mold exposure and their body's been able to tolerate it, but then all of a sudden they get a tick bite and now they have Lyme on top of it with an already dysfunctional immune system, now their body goes into a tailspin. And I also see this with other kinds of toxic exposures like heavy metals, mercury, cadmium, arsenic, lead, aluminum. People who are on the borderline with these toxins, sometimes that's the reason why they have a vaccine reaction. The average woman is exposed to over 200 chemicals just with her personal care routine of showering, shampooing, lotion, makeup, all of those things. Most of these chemicals have not been tested for human safety. And because you're not ingesting them internally, people think they're safe, but you put it on your skin and it absorbs into your body. And then you add electromagnetic radiation on top of all this. That has mushroomed in the last 10 years. We're now with 5G, and that is massive increase in the amount of electromagnetic radiation. So yes, it's not ionizing radiation. So it's not like an X-ray that breaks double-stranded DNA bonds and can lead to mutations that overtly cause cancer. But it's been well studied and proven, but not talked about, that electromagnetic radiation causes cellular inflammation because it increases intracellular calcium. And prolonged intracellular calcium leads to too much excitability of the cell, and that leads to the formation of a free radical called peroxynitrite, and that starts the inflammation cascade. We know that inflammation is the root of all illness. So if you're exposed to things that cause inflammation over and over and over again, and you don't have a safe space that's free of toxins, then that's how you get sick. So a lot of times, I'm going to tell you this, it's not one exposure. It's layered exposures, one on top of the other, over and over again. So people were doing fine. Maybe they grew up on a farm, and then they already had a tick bite, but they didn't get sick. And then they lived in college in a dorm that had mold in it, but they recovered okay. And then as an older adult, they get another tick bite, or they have another mold exposure, or they get a vaccine and they have a freaky reaction to it, and they're wondering what's going on. It's because all of those things were layering up over time, and now their body's overwhelmed. And because of their collection of symptoms and possible lab abnormalities, a well-meaning doctor gives them the diagnosis of some kind of syndrome. Well, I believe that our body has an amazing capacity to heal. And if we unlayer those exposures, you can get well. So don't take that diagnosis of syndrome as, well, I know what's wrong with me. I have this syndrome and I just need this medicine. Diagnoses are good in a way. They can give you validation that lets you know you're not going crazy, because sometimes you have these symptoms and you feel like, oh my gosh, am I going crazy? What's going on? Why do I feel this way? And so people will grab onto that diagnosis of, oh, thank God, I know it's not all in my head. I have a diagnosis. But get the experience of a doctor who understands to look deeper as to what the root cause is. Get the testing done for toxic exposures. Work with somebody who can help you reduce your ongoing exposures and get rid of the stored toxins in your body safely. If you do those things, you have an amazing capacity to heal. I'm Dr. Yvonne Karney. I'm the Hormone Locksmith. This ties into the Hormone Locksmith because there's nothing that rusts your locks like these toxic exposures. It totally damages those locks. Then your hormones and other things in your body don't work right. So don't take it with face value that that's what's wrong with you, is that you have this syndrome. Get help from someone who understands to look deeper. If you have found this helpful, please like or comment. Have you been given the diagnosis of a syndrome and this has given you new information? I'd love to hear that from you. And if you know someone who needs to hear this, please pass it on. Thank you.